there for a sec, but I'm good.
Yep, we're live. Yeah.
Amazing. Well, hi everyone. Welcome to this month's Flurry Care Digest. I'm Lucy Hartshorn, and I'm really excited to be here with folks from Rescue.co, Darshni Haria, the commercial director.
Whoops, I think we lost Lucy.
Yeah. Toby? Dash moving.
Let
Yeah.
me check.
We can
I'll check with her. I'll check with her. Just hold on a bit.
Sorry about that, everyone. Great timing for my internet to cut out. As I was saying, we're super excited to be here today with Darshni Haria, Commercial Director at Rescue.co, and Dr. Sheila Maina, the Medical and Partnerships Director. So thank you both for joining us today. How are you doing?
Good, thank you. How are you?
Doing well.
Yeah. We're good. Hi everyone. Hello from Accra, Ghana, which is where I am currently, as Darshani is in Kenya.
Yep.
Excited to be here. Yeah.
Amazing. Well, to give everyone a little bit of context before I turn it over to you guys, Rescue.co is Kenya's leading emergency response provider, and today they have over 2 million users across Kenya and are one of the most trusted 24/7 emergency service. It would be helpful to maybe let the folks know a little bit more about what Rescue.co does and what that means in the Kenyan context. So could you provide an overview of your mission and emergency response services in Kenya?
Yeah, definitely. So I mean, just to set the scene, our mission is to be the state-of-the-art life-saving service provider by building beautiful and useful tech that enables human professionals and a team of humans that drive, support, and enable that tech. And our overall vision is a world that no matter where you are or who you are, quality emergency response is only minutes away. So we started, by making that a reality in Kenya. Kenya is our first market. Not only market, but things coming soon. But we started it in Kenya about 7 years ago. And we are at the moment Kenya's largest network of emergency response providers, which means that we connect people to emergency response whenever they need it. And that includes ambulances, it includes road rescue services. So think tow trucks and security responses. And we'll also soon include air evacuation services as well. So no matter where you are, any location in Kenya at any time, whether it's the middle of the night, whether it's a holiday, whatever it is, we're able to respond to your emergency and make sure that you get help quickly. So that's basically what we do.
That's really exciting, and I think it would be helpful to better understand, what's the general landscape of emergency services like in Kenya? Is it relatively easy to get an ambulance if you need one?
Now it is with rescue, but before rescue, it wasn't really. The problem in Kenya is always that there has been no sort of centralized support system for emergency response. So although there have been many ambulances around, and that's an interesting, thing that we actually found that's quite unique to Kenya, in that there is almost an excess of ambulances. They're mainly owned by private providers, which means that there's no centralized way of accessing them. Now, if there's no centralized way of accessing them, it means that you have to call multiple numbers before you even manage to find one that is suitable, that's close enough, that is got the right equipment, that's got, staff in it already, and all of those things have to be considered. So if you have to call multiple numbers to be able to find out that information, it's a waste of time. And the more time you waste, the worse your condition will get, right? Especially in an emergency. So with rescue, we've sort of centralized that, and we've brought in what Western countries already see, which is, similar to a 911 or 999 service, where you can just call one number and we will find the response for you. So prior to rescue, I think the sort of response time in Kenya was anywhere up to almost 2.5 hours to get an ambulance. And now with us, with rescue, our average wait time in major cities in Kenya is about 15 minutes.
Wow, that's an amazing sort of shortening of that really critical time to go and reach emergency services.
Yeah, and I think I'd like to just jump in and just continue to paint the landscape, something that I think people forget, that medics, and I'm always telling guys at the office, the healthcare workers have emergencies too, especially in our kind of setting where you find not all hospitals will have exactly what you need. And so whereas almost 3 years ago, 99% of our cases were roadside calls, home calls, the typical 911, help me. Since we joined and had a lot of work that we're doing, it's 75% now is interfacility calls, where you're finding nurses are stuck with a mom. They don't have blood, or they can't perform a C-section at their facility. And so a lot of that is also, that burden has been eased in our healthcare system. And it's unfortunate because this is the kind of setup that is seen across the continent, but it is exciting to be on the frontier of change. And for those who are listening, when we do say end to end, it means we control the whole call and we take away the burden on either the healthcare worker or the person whose emergency it is, on finding out not just the facility, not just the transport, but also trying to figure out what they can afford based on their insurance. And so our service is purely bespoke, from the poorest of the poor, getting them the right care the first time, to the richer, wealthier clients.
Yeah, because like Sheila said, end to end does mean that it's not only about us answering the phone and dispatching an ambulance, right? It's about us answering the phone, understanding the condition, triaging the patient, selecting the right response, the right ambulance with the right equipment, sending that over, staying on the phone, speaking to the patient and making sure that they are doing certain things that can mitigate against their condition. And then coordinating with the ambulance team to find out, okay, what is the condition of the patient, and determining what is the right facility to take that patient to. And then also coordinating with the facility to say, hey, X is on the way, and here are their details, and here is their condition, so that even by the time they get to the facility, there's also no delay in admission, because that, again, delays in admission also, are life-threatening.
Yeah. So just to then also, I feel like Flair and rescue, more is more. Sorry. So what we've also done is tailor ambulances to the needs of our clients. So we have maternal cases that we've made mobile labor units. And for some of our moms in the rural area, it was really hard for them to make it to a hospital in time. We've had over 15 successful births in an ambulance, because we had our staff trained, we had the right equipment. So we don't just provide the transport, but can tailor it to the need and make sure we're sustaining life, until we get to the right place. Yeah.
Yeah, thanks for that overview. That sounds like an amazing kind of package of services that you guys offer, to take it not just from this, what's the ambulance and where are they 2 hours away, to, actually helping people get the transport, getting the right care on it, and getting to the right place where they can have their services met. And so who are your customers? Is this everyone in Kenya, or is it just, Nairobi or Mombasa?
Yeah, in my opinion, it's everyone in Kenya, or it should be anyway. Currently we have a massive user base, as you said earlier. We cover over 2 million people in Kenya, but we cover them all in sort of various different ways. We do direct B2C, so business to consumer, where people can actually just sign up as members, and then purchase a subscription for them or their family, which essentially covers them anytime they need us. There are businesses that actually take out rescue memberships for their staff as a benefit. We obviously have medical insurance in Kenya, and there are lots of companies that will provide medical insurance to their staff as a benefit already. But we are sort of the between medical insurance and emergency help, because as much as you might have medical insurance, at the end of the day, if you actually are in an emergency, your insurance person is not necessarily going to call an ambulance for you. So that's where the problem comes in, and that's where sort of rescue steps in, right? So we do work with some insurance companies, but a lot of the time, a lot of companies take this as an additional benefit. So they have medical insurance, but then they also have rescue cover. We work with a lot of mobility companies in Kenya as well, because they're very concerned about safety of passengers, drivers, that kind of stuff. So, it's really important for them to make sure that there is quick access, not just to ambulances in mobility cases, but also to security, because there can be a lot of security issues on the road. And then we also do a lot of work with county governments and in counties in Kenya. So we have specifically a lot of work to do with maternal and newborn emergency response.
Yeah. That sounds like a really kind of interesting way of bringing together a lot of the different elements of, the emergency response system. And so it sounds like rescue coordinates with, not only the transportation, but hospitals, governments, businesses, things like that, if I'm hearing you correctly.
Yeah.
Yeah. That's fantastic. So, how would you say that, rescue has been able to sort of address and overcome some of those challenges you were talking about in the beginning of a long wait time, not sure where to go? Have you guys been able to kind of fully solve those problems so far?
Yeah, we've solved, I think, quite a few of them, and that is due to our purpose-built, sort of award-winning tech platform, right? That's actually built specifically for being able to solve dispatch issues. So we don't have our own fleet of ambulances. We don't have our own fleet of any type of emergency response, but we partner with everybody in Kenya, right? So that means we track, we monitor, we inspect before they actually get listed onto our platform. And we can see wherever they are, and we can see where our patients are. So we work in a very similar way to sort of ride hailing companies where, you need a taxi and it'll find the closest one. It's very similar to what we do in that, you're having an emergency and you need the closest ambulance. But the difference is it's not just the closest, it's also the most appropriate. So that's sort of how we work and how we've addressed the issue of long wait times.
Mm-hmm. Yeah, and so that gets to one of the questions I was going to ask, which is about how some of your technology solves the challenges around, coordination, response time, access to care.
Yeah, exactly that. And then on top of that, our dispatch team is not just anyone. Every single one of them is medically trained. So it's they're very able to assess what exactly the situation is and what is going on. So they are able then to determine exactly what ambulance or what team should be sent over to deal with that patient. So by by having that sort of entire process locked down from the tech to the dispatch team and everybody understanding what is the mission and what needs to happen, we're able to address a lot of the issues that we've seen before in the emergency response space.
Mm-hmm. Yeah, and I think that's something that's of particular interest to Flurry customers and for their loved ones back home in Kenya is okay, we're going to call an ambulance, but is it just going to be a car that takes you to the hospital, which is helpful, but how do you make sure that it's high quality care that's being delivered between where you're meeting people and where you're taking them?
That's where I come in. So literally, fieldwork is looking for our ambulance partners, and it begins with then inspecting the vehicle. And our tech is powered such that whatever we inspect based on our checklist that we have is immediately uploaded into what dispatch can see. So dispatch has a real-time idea of who's in the ambulance because we have mapped and audited the staff in the ambulance during an inspection. We've got a list of equipment and everything that's inside. Yeah, that's what happens now, real time. And then obviously we really train them, have the drills. And then during a call, because our dispatch is medically manned, if they need any help, any medical direction, they do escalate to dispatch so they can be guided. That's how our tech also plays that role, but also to give the customers peace of mind. Do know that there are medics on the ground doing spot checks beyond the initial inspection. Because I know sometimes guys are like, yeah, but they could have just put it the first time. We do monitor as often as we can to make sure that we're giving the best quality of care to our patients.
Mm-hmm. Yeah, which is so important. And so you said that, it's medically trained professionals that are in those ambulances picking patients up. What does that mean?
So we have very different cadres across Kenya. So you could have a basic EMT or an advanced life support EMT up until a doctor who's been trained in ICU. And so when we're talking about mapping, we map per provider, the staff, their qualifications, their licensing, their certifications. And then we look at the ambulances that they're in. Sorry, it's been a long day. I was losing my thread. What, Ramin, your question? I'm so sorry.
We were talking about who the medically trained professionals are that are in those ambulances.
Yes. So most times it's a basic EMT. In critical cases, we will have them accompanied by someone with more qualifications. So either a nurse, or Kenya is the second country on the continent to have a paramedic bachelor's degree for 4 years outside of South Africa. So we have paramedics that are in the field as well. So it's very exciting. Yeah. Mm-hmm. But then again, matching it to the case. Yeah.
Yeah. And is that ability to match to the case? So let's say you have, a more acute or severe maternal complication in a remote area. Is that an option, or is that just for when you're, if you live more in an urban area with, easy access to more specialist care?
Oh no, we went beyond, like, for our moms, and made sure that all our paramedics, EMTs, nurses have the necessary trainings, skills, certifications. For example, this training EMONC that WHO came up with. So when we're moving in, the whole point of adding our partners is also to match it to the environment. And then, because I think borrowing from tech, being iterative and agile, as we learn on case-by-case basis, we're very quick to respond to what it is that we are finding. And based on things on cultural nuances, what the community prefers, all of that makes us come back as a team and be like, okay, what can we design for X? And then we test it out in different areas. So whatever worked in Kakamega, for example, we've piloted it in Nairobi, and it's working. And so, but we'll tweak it obviously, because in Nairobi, most people will have most facilities close to them. It's not the same infrastructure is not available, right? But we are ready in the event. Maybe you're stuck in traffic and you have to push. But yeah, we're always iterating, being agile and adjusting. We're not promising we're perfect 100%. Things are always dynamic. It's an emergency setup. We're in Africa. There's so many challenges, but what we do guarantee is that we are always working with the best providers to give the best care to our patients.
And I think on top of that, we're also actively involved in a lot of research. So we've done it before. We are doing it right now, where we're actually researching on emergency care for trauma cases, for maternity cases, and and we make sure that we sort of disseminate that research as well, right? So that the key stakeholders have it, and they're aware of what is the reality on the ground, what's actually happening. with maternity cases in Kenya, so that they are then aware of what is the sort of maybe training programs that need to take place in schools that maybe they haven't done up until now. What are some of the new policies that they need to put into place regarding mothers and babies that maybe hasn't been there up until now? So we always try and use this sort of data and information that we collect to inform change and try and push for change.
Yeah. And I think that will be really reassuring to folks that are, using rescue through Flary, that, not only is there this suite of different providers, but there are a lot of systems around iterating and improving both. It sounds like the quality of the staff you have, but also the broader health emergency ecosystem.
Yeah,
Absolutely.
exactly. I mean, even internally, and Sheila can speak more to this, but like our dispatchers also have to go through like very rigorous boot camps before they can actually be part of our dispatch team. So I think that's been like set up by Dr. Sheila and team, and it's pretty grueling as well.
That, and we always keep up with our certifications internally as well. So we're not expecting all these things of our EMTs that our dispatch can't match. We have to stay up to date with all the newest guidelines so that we can guide. And there are times that we'll be, because we are a community, we're medics, and learning is always continuous. So we help each other. We will arrive at the scene and maybe it's a hospital, it didn't have adrenaline. The ambulance has it. We participate in stabilizing the patient. So when we sharpen each other, it's only for the benefit of the patient.
Yeah. And Dr. Sheila, you were mentioning earlier about, borrowing from sort of the tech world, this idea of iteration and feedback. How has Rescue used feedback from communities themselves, or, potential customers or the loved ones of Flary customers, to make sure it is, meeting their needs?
Oh, wow. So much. Like I'm trying to find the thread. Everything. I mean, I told you, the service is so bespoke. So when you're in Nairobi, I mean, most people are speaking English as we started out, right? We kicked off in Nairobi. Most calls are coming in English. We go to Kakamega, we're getting community calls. We have to adjust our protocols so that we can understand what they're saying. You know what I mean? If it's different dialects, if someone's calling in, speaking a different language and they're in panic, we make sure we have someone who can help with the translation in that emergency. And just, I guess, bigger things like we were mapping out when we're working with the county hospitals, you're going to places where nurses are having to use their own airtime to access the county ambulance services, for example, because the hospital phone ran out of airtime. So we provide a toll-free line. Simple things that are life-saving. Now you can call, and so we listen and we adjust accordingly. You know what I mean? If the community health promoters feel we are talking too fast or speaking too much English, we come back and tell the team, slow it down, switch to Swahili. Let's adjust the questions. Do they need to be 13 or can it be 5? It's constant. We're working with county and it's like, how do we work between dispatch centers so that it's seamless? So when we talk about insurance, doing the back end work, and Dash will go pitch it to private insurers, but then make sure customer care centers of insurances are not then the blocker for us. And then going to like ambulance providers and being like, you have your own protocols? Yes. So Lucy has her ambulance. Lucy needs to know as a CEO, how many calls did we do today? Yes, but does Lucy need to know at every time that you get the call? Does Lucy need to fuel the car every time you get the call? No. So what we discuss with providers is like, hey, if we say, hey, are you available? It's a hot case. And you're like, yeah, start moving. And Lucy, in the evening, you get a whole summary. On our Flare device, you get a feedback. So we're constantly tailoring it for our private providers, for county hospitals, for our community, so that it is seamless. So it is this slick, you dial or you click the SOS button and it's, hi, you reached Rescue Co. Dispatch. What's the location of your emergency? That's what goes into it.
Mhm.
We also, we collect feedback every day from our patients and callers. So that's actually a structured process within our dispatch system to actually find out from the patients, how did it go? What was your thoughts on this? And can you give us any feedback, and make sure, and not just, it's not just a sort of um, very
Nice.
sort of cold call where it's like, oh, hey, what's your feedback? It's actually like, how are you doing? Are you okay? And then we've actually used that in the past. So I think when it was the elections, we got feedback about certain areas which were quite insecure. And so what we then did is adapted to safe pickup spots, for the safety of our response teams and our patients, so that we weren't picking them up just anywhere,
Mhm.
and putting them in danger. Another thing is, like, right now it's been very, very rainy in Nairobi. And a lot of Kenya has been flooding. And so we've gotten feedback on the roads and the fact from our ambulance partners, saying that some of these roads are actually completely inaccessible and they can't pass them. So we've actually had to switch to land cruisers to be the ones to go through that kind of terrain. And then we also do it with private companies. So one of the mobility companies, for example, that we work with is Bolt. And we've done very thorough trainings with their drivers and with their riders to make sure that they understand what does it mean to press the safety button and what exactly is rescue going to do for you, so that they are very clear, they can understand, and they can give us feedback to say, well, actually, we'd rather you do this, or this is how you should respond, or, we might not be able to answer the phone, so can you just come anyway, things like that, so we can improve our service as well.
Yeah. Sounds like an impressive amount of work all happening behind the scenes to, as you're saying, you make it this seamless experience so patients can not only, it sounds like access it easier. It's in the dialect wherever you're calling in from, they'll talk slowly for you, but also to quality of the care you're getting. So, the hospital is ready for you when you get there, pieces like that. So really impressive on the back end of things to make it seamless for patients themselves.
Yeah. Thanks.
I'm curious, if you can help us paint the picture for what this looks like in action. What are any notable case studies or success stories that you guys turn to when you're thinking about the role rescues played in emergency response?
There are many, but Sheila's, I'm sure, got quite a few. So.
I think Darsh can jump in. The notable cases, yes, but I think the reason I'm at rescue is solely because I called them. I used to work in county. I was in Kipi, I was 4 hours away. Didn't know they existed. Was a healthcare worker looking for an ambulance when I had a heart attack patient in 2018. Went to a doctor's WhatsApp group, sent a list of here ambulance numbers, try. And the one that did speak out to me was the one with 911 in it. I was like, 911. Click. And I was connected to Flare. And that was the first time in 3 years that I was able to save a heart attack patient same day. And so, yeah, he got the actual definitive treatment, what I guess Americans would take for granted. You can go to a cath lab and have your artery unlocked. Yeah. In Kenya, it was oh my God, he did it. 3 days later, he's walking. Oh, Jesus. It was very emotional. And then I remember presenting this story at an innovation week where someone from Flare was listening, met Caitlin and Maria. And I was the first out of Nairobi call for them. And they had narrowed this time down in Nairobi to about 20 minutes at that time. And it took them 3 hours almost to get me an ambulance. And I remember the dispatcher kept calling every 10, 20 minutes, being like, Doc, the ambulance is coming. It's coming. Don't worry. It's coming. And I was like, seriously? Because I was in casualty and I had so many patients waiting for me. So I was like, oh, I can just chill. Help is on the way. I've stabilized my patient and I can now, because I remember it was 6:30 p.m. on Monday and the ambulance reverses back and I'm in a theater that can see the entry and I walk out gloved and I watch him being wheeled into this mobile ICU unit and I'm like and the moment he arrived in Nairobi, within I think it was 13 minutes from the door to cath lab to ICU, And I was like, it was all for that. And I was like, we need to talk about this. We need to build this platform. People need to know what that's like to have done your best as a healthcare worker, everything you can do, and then make that call. And that patient is in good hands, like the continuum of care actually, like they make it because of that. So for me, that's my case. Darsh.
Yeah, I mean, that's awesome. Actually, I didn't even know that story, but that's awesome.
I was like, I swear. I remember breaking down crying, and I asked this guy, and he sent me the brothers, because he'd come with his whole family in the ER, and I'm like the story was just, it was, the way it came out, it was just nuts. And I was like, we managed to save him, and 3 days later he's walking because the largest artery of his heart was blocked.
It's amazing.
Like, I presented this case in front of cardiologists and our first lady then, Margaret Kenyatta. And it was so interesting because it was all medics from across the continent. So I put up the ECG, and you hear the whole room go, oh my God. Like the waves were literal, they're called tombstone waves. Like, that's how much damage we could see going on. And so you literally are seeing, because once the heart muscle dies, that's it. It doesn't come back. It doesn't regrow. And so after, the more that it dies, the more the heart limps back to life in a way. And so you just reduce your chances of like even having a decent life afterwards. So that meant everything to me. And I'm just so grateful to be on this side. Like, let's go out, let's get more people, let's get this number out, Yeah.
Yeah. And I mean, I think there are a lot of stories now like that. We see them all the time. We've got a sort of internal channel amongst just us where we share some of our most amazing success stories. And, I'll sit there reading them sometimes like, what the hell? Like, are you serious? That's crazy. I didn't even know that could happen, I mean, there was one that particularly stands out to me where there was a teacher who was on Mombasa Road, and Mombasa Road in Kenya, as I'm sure you know, Lucy, is like a super busy highway. And they were just standing there waiting for a bus. And for some weird freak reason, a billboard fell on them and they were seriously injured. And, luckily somebody passing by knew our number and called us. We got the ambulance there in under 15 minutes and managed to get them to a facility, stabilize them, of course, and managed to get them there. And they were perfectly fine. So it's like, this crazy freak accident, which you'd never even think about. But somehow, we were able to be there and save that person. And if I thought about this 8, 9, 10 years ago, I wouldn't even know what to do. Like, I would have no idea who to call if I was that person.
Or if you got that list of WhatsApp numbers that Dr. Sheila got,
Exactly.
and you're on the side of Mombasa Road just calling all of them. Yeah.
Exactly. I'd be there standing there, calling one by one.
Yeah.
But like, just to bounce back a little, when you talked about feedback, so another thing we'd noticed is with our roadside pickups, some motorbike guy has been hit. He's on the side. We need to move him because he's got fractures. He's like, what about my motorbike? We're like, what about your leg? And so it became fact, because that's his life. Maybe it's out on loan. So we came up with this towing service, right, that we provide in Kenya. And another story. So my sister is also a doctor, and she's doing her internship in Thika, which is about 40 minutes out of Nairobi, 40 to an hour. And so she's on this major highway that's connecting like Nairobi to like Nyeri, the central parts. She's like in the middle of like this 4-lane highway with no exits around, no petrol station. Her car stalls. So she calls home. I was visiting and I was like, my mom comes in and she's like, oh my God, we need to go get your sister. She's stuck, the car stalled, like cars are around, everyone's freaking out. And I was like, chill. Dispatch. Literally, because my mom stood there, she's like, what do you mean? Get your shoes. I'm like, at the door. I was like, just wait. So my sister, this is a location. I'm like, okay. I call my sister. She's figuring out, I don't know what to do. I'm like, okay, cool. You're on WhatsApp. You have bundles. Good. Drop your location to this number. So she sends her location to the dispatch WhatsApp. And then within 25 minutes, a tow truck was there to pick up the vehicle. She took pictures and video. And we had also organized a cab for her because how else was she going to get home? And they escorted her to exactly where she needed to be dropped off. Like my family was just like, I don't understand. I'm like, yeah. Like, we're in the field. That's why we do what we do. It is the best feeling. It's the best feeling. Like, I can't explain. Like, you're walking around knowing people have your back. And Dash, I think this before you joined, I was 3 months in, and we go on Slack, the company Slack. And it's like, is it Friday? Like 10 p.m., just another regular day in rescue. And someone's called in, they know about rescue, and they want to be rescued from Liberia. Oh, yeah. And we did it. We coordinated it. Yes. It's crazy. It is literally like once it's like that in those movies, when you're like, you call base and they're going to get you out. That's what we do. No matter what. We're never going to be like, what? Sorry, I don't understand. It took 2 days. There was a patient in the facility, something, but they really needed urgent care. But you could just see it. You can see this coordination going on. Another one, out with, I think, Serengeti.
Yeah, that's the one I heard about. Yeah, exactly. I mean, we haven't even launched Air yet, coming soon. But there was a member of ours who did actually need to be airlifted from the Serengeti back to Nairobi. And I think, because we didn't have air evacuation at the time, I don't think we were sort of his first point of call. And he tried a couple of others first, and he just wasn't getting anywhere. So it was like, super frustrated, like, what do I do? And so it was like, rescue, can you just help me? And so we were like, okay, we'll do it. and we did.
Yeah. Because it's like, okay, we know things, right? We know on your insurance, we know you have access to air care with these signed partners. Now, in your emergency, is it the time for you to know and start looking at your pre-approved list and calling and then checking whether the plane is like ready to turn around? It's not. So we bounce off, and that's why we love partnerships. That's why we collaborate. We are smoothing this whole coordination process so that it is slick. It is about what does he have? Who do we need to call for him? So that it can work. And that's what we need to do. Yeah. Working with what
the more insurance companies we can work with, the more providers we can work with, the better, I think, the entire ecosystem for everyone.
Yeah. And I'm just reflecting when you guys were talking about all the work you do behind the scenes and making sure it's seamless for the patient. I also think that makes it so people have a lot of peace of mind, is what I'm hearing from these stories, is that, we can call rescue. We don't totally know how they're going to get there or what the insurance is, but we can call you. And or for, Flurry customers who are maybe in the States and their mom is in Kenya, they don't have to step out of work and, call all these WhatsApp numbers on so their mom can get the ambulance.
Exactly. That's exactly it. Like, we want you to rest assured and to have that peace of mind knowing rescue is on it. You don't have to sit there and like start messaging everyone, like calling everyone. Like, we are doing it for you. Don't worry about it. It will be done.
Yeah, that's fantastic. And you mentioned air rescue, and you mentioned doing a rescue in Liberia. I think it sounds like you guys have this really fantastic system in Kenya. Are you planning to go elsewhere? Are you planning to add elements to Kenya's operations?
Yes, definitely. We have lots and lots of potential for growth, and we are definitely in that stage at the moment. So we are launching air evacuation very, very soon, probably in the next week, in fact. So that's going to be really exciting because we're going to have an air evac product for Kenya, for East Africa, and for Africa. So, people will be able to be covered for air evacuation no matter where they are on the continent. And it means that even when you're in a super remote area, or whether you're on the top of, let's say, Mount Kenya, you decided to take a trip up, we will come and get you, because not only are we going to be partnering with people with fixed wing airplanes, but we will also have helicopters that will be able to actually evacuate people. So they'll be able to actually come and get you from the top of the mountain and bring you back down. So that's one of the ways which we're expanding. But then we're also launching in other countries. So that's where Dr. Sheila is right now, and why she is in Ghana, because Ghana is launching very, very soon as well.
Yes. It's part of the award-winning, as you introduced us, because we had the honor of being one of the inaugural winners of the Kofi Annan Award for Innovation in Africa last year. So it saw the Austrian Development Agency and the Kofi Annan Foundation come together to award, or rather look for companies in Africa that they could support to increase their footprint. And so out of, was it 330 people or companies that applied? We were in the top 3. And it's really fantastic to be here. Today, actually, we've done our second tracking of our second ground ambulance, and the tech is working fantastically. So after a few more drills and a couple of trainings locally to get it right, I hope to also be sitting like Dashani and saying, in a week's time, we're going to go. But yeah.
Well,
But
call us
we're
back when that
we're
happens,
super
and we can do another one of these 1 week before, so you just
Definitely.
get that moment.
Yes, Lucy.
Perfect.
But I mean, we know we're not going to stop at Ghana. I mean, our plan is to cover a lot more of Africa, and not even just Africa. There are a lot of developing countries out there that don't have a working 911 system. And so, rescue's potential is limitless. There is a lot of work that needs to be done around the world. And that's what our vision is. So, yeah.
Yeah. Super exciting. I think in the last couple of minutes, I do just want to touch on sort of some of the ways that the diaspora and Fleury customers can engage with rescue, besides purchasing rescue via Fleury and being a member that way.
Yeah, I mean, so purchasing via Fleury is probably one of the easiest ways, because I think Fleury does make it easy for anyone in the diaspora to actually purchase that membership. But I mean, we have a very easy to use website that makes it super, super simple to sign up. It's you can pay by card if you've got M-Pesa, and wherever you are, you can pay. And the membership options are extremely affordable. So to cover one person for ambulance response for a year is only 4,000 shillings. And there is no additional cost then to the ambulance. So that's about, $20 to $25 roughly. So almost nothing. And then they would never pay anything more for the ambulance. And the more people you add, so if you're going to add a family, maybe your whole family back in Kenya, then the cheaper it becomes per person as well. So it's really, really simple to sign up. Whether you just want the ambulance, or whether you want to add on road and air, you can do that very, very easily.
Well, that's great to hear, and I'm sure folks will be interested in checking rescue out. And thank you both so much for chatting with me. I have so many more questions, but I'll have to save them for before Dr. Sheila comes back a week before Ghana goes live.
Yeah, definitely.
Yeah. Well, before we close, anything else that I haven't asked you about that you want to say to Fleury customers, to people tuning in to hear more about rescue?
I think on my end, I would just say, let's not take this for granted. We've all in Kenya become so accustomed to workarounds when it comes to emergency response. A lot of the time, people will say, "Oh, I'll just drive myself," or "I'll call a neighbor and they'll drive me." But that's not what you should be doing, and that's not what your expectation should be. We are here, and we're here for a reason, and it's as easy as just picking up the phone, and we will come. So don't think that there isn't a solution in Kenya, because there is.
Yeah. And thank you to all the ones who already signed up, to the ones who share our website on WhatsApp groups and spread good things. It's amazing. I know I'm in many doctors' WhatsApp groups, and it's amazing every now and then when someone's like, I need an ambulance. And some of these doctors are abroad looking for people. Like, they're like, oh, my so-and-so in this part of the country is stuck. Where can you? And it's like, these guys are really effective. Rescue Co. And you're like, amazing. So to
Yes,
all
we
our
are.
support, you. Yeah, it's not for sure. We take this very seriously. So thank you for your support. Trust us with your loved ones. It's worth it.
Definitely.
Amazing. Well, thank you both. If people have questions and they want to, reach out to you, do you have Twitter?
Yeah, we're not super active on social media, unfortunately. But our website does have, very easy forms you can fill if you've got any questions. So I would recommend just check out our website and drop us a message if you do have any questions.
Amazing.
Yeah.
Well, thank you both so much. I know it's very late where you are. Really appreciate chatting with you, and excited to follow along with what else Rescue is doing.
Thank you. Thanks for having us.
Thanks so much. Take care.
All right.
Bye.
Bye.